Did you know? A lot of people think that if your heart valve is damaged, you have to have open heart surgery. But there's now a minimally invasive alternative called TAVR, transcatheter aortic valve replacement. Think of the aortic valve as your heart's gate, controlling blood flow to the rest of your body. When it narrows, the heart has to work overtime to pump blood. TAVR can fix this without opening the chest. A doctor threads a thin catheter through a small artery in the leg or arm. Inside the catheter is a new valve, folded up like a tiny umbrella. Once it reaches the heart, the valve expands and gently pushes the old valve aside.